Good evening, everyone. This is Bernd Christian Giels coming to you once again from Hyannis here on beautiful Cape Cod. Today is Sunday, August 9th. It is about 7:30 in the evening. The last light of the sky is filling up behind me right now, and I'm going to be recording one more episode today. This one is focused on the very timely issue of the American healthcare system. This episode is specifically based on an article that I wrote on June 4th of this year, in which I wrote a persuasive essay about the need to improve our healthcare system here in the United States of America. So this particular episode here on my YouTube channel is based specifically on the content of that document. For those of you who have discovered me recently or not so recently who would like to read this article, I am in the process of learning about how to upload more differentiated content to my YouTube channel. So in the near future, hopefully I will start loading up content including many of my various writings, and you'll be able to read some of this content for yourself directly. So, as I said, today I am speaking about the healthcare system here in this country, the United States of America. And I wrote this article, like I said, in early June, and it was actually inspired by an article that I found on slate.com. If I am able to track down that article, I will also note that in the information box on the page for this episode on my channel. So, I fundamentally believe that we need to radically improve our healthcare system in this country. And I make that statement partly because, in my considered opinion, the current system that we have is woefully inadequate to the pride and international reputation that the United States of America has enjoyed for many, many decades until fairly recently. Now, I grew up here in the United States of America, but my mother's family is from Germany. My mother is a German citizen, and my mother's siblings and their children are all German citizens. So I have had the privilege throughout my life of being able to travel internationally. I've traveled to much of Western Europe. I've traveled to Hawaii. And so I've been able to enjoy and experience different cultures and different systems when it comes to things like social safety nets and healthcare systems. And so it's that experience in part that informs my perspective about what some of the major issues are here in this country and how we might improve our healthcare system. Now, this particular episode is going to focus pretty much specifically on the issues themselves, and in a subsequent episode, I will spend time focused specifically more on the question of how to design a more compelling, effective, equitable, inspiring healthcare system than the one that we have now. So this episode specifically is going to look at the problems, and a subsequent episode that I will prepare hopefully in the next couple weeks will look more specifically at the potential answers to these issues. So, my observations, based upon my own life experience and the reading that I have done both recently during the COVID-19 pandemic as well as not so recently, are the following. There are four major problems, as I currently understand, regarding our healthcare system in this country. Now, there could be more, and the way you frame the discussion can obviously influence how many problems you identify, but in regards to the way I think about it, this is what I have come up with. One of the first problems that I identified in my article is that the healthcare system in our country is what I would say under-resourced. And what I mean by that is there are simply not enough resources in place, whether that's actual physical infrastructure like hospitals and clinics, or trained staff like doctors and nurses, or personal protective equipment or other technologies and other items that are used in the daily delivery of healthcare throughout this country. We do not have adequate resourcing for our healthcare system in this country. And because we do not have adequate resources, we suffer the consequences of that in a number of ways, some of which include people who live in impoverished and rural areas can find it difficult to access quality care. Sometimes people have to drive great lengths to find a hospital that will actually have the staff available to perform a needed procedure. There is also the issue of the supply of the professionals themselves. So not just the physical infrastructure to go to have procedures done, but having the people that are necessary for the procedure to be done. Also of great concern is the affordability issue. A lot of problems in our system are of a financial nature. And that definitely distorts the care that people are able to access and afford to pay for. So as I noted in my article, the system is under-resourced, and we have seen an amazingly sharp and sad example of that during the COVID-19 pandemic with the issue of a shortage of PPE, or personal protective equipment. And sadly, even now in August, nearly 5 months since the first lockdowns were put into effect, we still, even now, are facing this issue. And I would say that that is an immense tragedy of a lack of vision and a lack of coordination and sufficient resources being put into place. So that is one major issue with the system. It is under-resourced. And what's even more incredible about that is that during this very sad time, we are watching the current administration actually seek to strike down Obamacare. And a pandemic is not really exactly the greatest time to take health care away from millions of American citizens, especially after they've already lost their jobs and now face the possibility of losing their homes as well. So it's quite clear that our priorities are seriously amiss. Secondly, the system, from what I have seen, has bias and prejudice within it. Now, what do I mean by that? What I mean by that is that despite the Hippocratic Oath, in which medical students are, as I understand it, expected to make a promise to do no harm, there is still within our healthcare system, as there is in so many of our systems, issues of prejudice against a variety of populations of people. And one thing that thankfully has been, I think, given a fair bit of coverage during the current crisis with the pandemic is how much inequity there is in the system in terms of the outcomes that people can expect from the health care that they receive in relation to their personal background, specifically their racial background. A lot of people who have been dying from COVID-19 are people of color. A lot of people who have been dying of COVID-19 are also people who are elderly, who are living in care facilities specifically designed for their age demographic and healthcare needs. And something that I find very tragic about the current situation is that it harkens back to the AIDS epidemic of the 1980s. Now, what do I mean by that? In the 1980s, the AIDS epidemic struck down the lives of so many Americans. And yet the federal government at the time did not rouse a concerted effort to address the pandemic, the AIDS epidemic, I should say, until long after it had begun. And one of the major reasons that there was such a delay in providing appropriate attention was the fact that initially AIDS was understood to be something that was primarily, if not almost exclusively, impacting the LGBT community. And so bias, prejudice, and hatred of the LGBT community was one contributing factor to the slow response to the crisis. And just as then with the LGBT community, now in 2020, we see some of the same issues of bias and prejudice at work in the system. In the current example, it's people of color, it's the elderly who have been suffering a lot, who have been suffering disproportionately in terms of the number of deaths that they represent of the total number of deaths, which now exceeds over 160,000 Americans. It wasn't until the presidency of Bill Clinton in the 1990s that federal government efforts to address the AIDS epidemic substantially improved. And that was a number of years after AIDS first became a major public health crisis in this country. That was about 10 years after some of the first earliest cases of AIDS in this country. So, that is another major issue. The first one I said, our system is under-resourced. The second, it is biased. It has issues with providing adequate care to people regardless of their background, as well as their socioeconomic status and other factors. The next issue that I see with the system is that the system is siloed. Now, what do I mean by siloed? I mean that there isn't enough research that's being done and information that is being shared across disciplines. One of the most tragic things that I think goes on in this country that is continuing to go on despite the number of incidents that happens every year is the crisis of gun violence in this country. Now, for those of you who are watching who are younger viewers, you probably were too young at the time to have heard the history about this. But back in the 1990s, there was a prohibition that was started. It started in 1996 when the Dickey Amendment passed Congress. And this rule, what this rule did that was contained within this amendment, was prevent the Centers for Disease Control from using funds to, quote, advocate or promote gun control. And so basically one of the major issues as to why it's been challenging to better address that particular public health problem, the gun violence crisis in our country, is because the ability to effectively research it has been stymied by issues such as this amendment that was passed by Congress in 1996. Now, in one sign of progress, however, thankfully, Congress recently did pass a piece of bipartisan legislation designed to provide $25 million for research on gun safety in fiscal year 2020. Now, what I'm sharing with you here in this episode is based on, like I said, an article that I wrote in early June. I have not researched if there has been any status change in regards to that funding allocated for fiscal year 2020 since I wrote that article. But at least it was one encouraging step that there were some efforts on a legislative level to improve funding for research related to the issue of gun violence in our country. Now, on the note of that particular public health problem, and on the topic of this assertion I've made that the system is siloed, I recall another article that I read. It was within the last couple years. It was on Huffington Post, and it was an article in which a healthcare professional was interviewed and basically spoke about the moving power of seeing the graphic nature of what bullets do to the human body. And as I recall, the person who was interviewed in this particular article was stating that if the American public saw the graphic quality of what this particular crisis of violence does to human bodies all throughout this country, if more Americans appreciated the damage, the wounding, the lives lost, the lives forever disabled, the families left behind, if we saw the damage firsthand or saw it portrayed accurately more in the media, if it were presented more truly for what it is, then we would perhaps have a more urgent sense regarding that particular crisis within our broader healthcare system and challenges in this country. So, when I talk about the healthcare system being siloed, what I'm saying is that there isn't as much research and information sharing being done across disciplines as would be ideal to help us to create a more workable, equitable, effective, responsive healthcare system. Now, another example of the siloed nature of our system, I think, can be found in a certain thread of the stories during the COVID-19 pandemic here in 2020. So, as some of you have probably already read, one of the particular places that COVID-19 outbreaks have occurred is in the meatpacking industry. Now, a number of years ago, I actually worked for a Tyson chicken processing plant. So I had firsthand experience in that job of seeing the inside of a meatpacking facility and getting a sense of the physical demands, the spatial demands, the type of technology that was used, and so on. And it comes as no surprise to me that there is such an issue with the meatpacking industry in terms of COVID because of the minimal physical distancing that occurs between workers in many settings. And if you take a moment to apply some critical thinking to this, the reason that would be makes perfect sense, right? When you're running a business and you're seeking to turn a profit, you're going to try to minimize expenses and maximize revenue in all the different ways that you can. And one of the ways that you can effectively use your financial resources is to minimize the amount of space that you use, right? If you have to pay a large amount of rent on your building that you use to run your business, it's going to drain your bottom line. And so obviously you're going to do as much as you can in as small of a space as possible. And so what does that mean then if you work in meatpacking? You're going to try to minimize the amount of space that your workers need to be able to do their jobs. Well, if suddenly you're pushing everyone at least 6 feet apart for the purpose of social distancing, what does that do to the amount of space that you're going to have to allow all of the workers that you have to complete their tasks on a cutting line, on a conveyor belt? If you have to space everyone out 6 feet apart, then you're looking at a significant change to the way your business has to use space, and therefore you're looking at the potential loss of significant profit. And this very issue of social distancing during this time of the pandemic is something that is basically insinuated itself into many different parts of our lives and has many different implications. As an example, one of the issues in the field of education is how do you effectively bus school children to school and yet social distance them 6 feet apart with the existing amount of buses that you have? So just like a meatpacking plant where you have to spread people apart and it has implications for your financial bottom line, so does it in that case. So the point I'm making here is that our system is not sufficiently responsive, and part of the reason it's not sufficiently responsive is because it is siloed, because there is not enough sharing of information, there's not enough research that's done, and on a related note, I think another contributing factor is the fact that profit is a major motivation in our capitalist society. And so profit oftentimes is a motivation that is held higher than the safety of the people working in a company. So the last comment that I want to make is the issue of injustice. And this is deeply intertwined with the issue of bias in the system, right? So bias in itself, by itself, doesn't necessarily lead to injustice if you're not acting on the bias, right? If you're a biased person, if you have a prejudice against another group of people, but you don't have the context in which to act out of that bias, then you're not necessarily contributing to an issue of injustice in your community. But we see this as another fundamental problem in our country right now, I would argue. Our healthcare system is not just challenged with bias, it is also a system that does, sadly, perpetrate injustice. And one of the major injustices that we're now seeing is how vulnerable Americans can be when their health insurance is directly and only tied to their employment status. In the last 20 weeks, in the last 5 months that this pandemic has been going on actively and expansively in this country, we have seen millions and millions of Americans lose their jobs. Now, some have been furloughed, some have gone back to work with reduced hours, some have taken pay cuts to be able to retain their positions rather than lose their jobs. There are a lot of different accommodations and ways that people are trying to cope with this very disconcerting, confusing, chaotic time. But the bottom line is that millions of Americans are suffering now, and it's partly due to the fact that our system has health insurance too deeply intertwined with employment. So what are Americans supposed to do if they can't get sufficient insurance once they're unemployed? And this is not to even begin to have the discussion about what happens for people with pre-existing conditions who are nonetheless employed, people with serious life-threatening conditions, people with health conditions they've lived with their entire lives that require significant medication or physical therapy or other forms of therapy. There are many, many, many Americans who face serious consequences due to the fact that right now our system is not sufficiently robust to account for the many possible things that can go wrong in a life, such as losing your employment and then losing your health insurance and then not having the resources in place, even if you have an option provided through your state if you should become unemployed. There are simply not enough resources for so many of us. And I include myself in that. I've experienced that myself. And it's from my own personal experience, as well as what I have read about, what I have seen in the lives of other people I call friends, that I feel that my observations, which I'm sharing in this particular episode, are valid. So to sum up, the 4 major issues that I see, at least these 4, that exist in our American healthcare system are that the system is unjust in many respects. It is under-resourced in many respects. It is, sadly, also burdened by bias. And it is, finally, at the very least, siloed. It is not sufficiently responsive because the sharing of information and research and cutting-edge discoveries and therapeutics across related disciplines could stand to be improved. And so those are my observations about the American healthcare system. This is not an exhaustive listing by any means. This is what I wrote in my article from June 4th of this year. And for those of you who are wondering, no, the article was not published in any currently accessible media, whether digital or in paper form. It did not appear in any media other than through my own sharing of my article with friends through private transmission via email. If you are interested in reading this article, please continue to stay tuned to my site. By the time you're watching this episode, I might have already created a robust site where you can easily access different types of content that I have produced. So, Thank you for watching this episode. This has been episode 34, my observations about the American healthcare system. I welcome you to share details of this episode as well as your knowledge of my channel with your friends, family, colleagues, and even your pets, because I know pets can find people chatting on YouTube entertaining, especially if they are cats and dogs. Thank you again for watching. I will be back in the coming days with more episode content. I welcome you to follow along. And like I said, I welcome you to share my channel with your friends as I seek to build a robust viewership here on my channel. Thank you, everyone. You have a great Sunday night, and I will be back soon. Bye-bye.